Okay, I think we'll get started. Welcome, everyone. Sorry, I have a few internet issues, so I'm going to keep my camera off. I'd like to start with an acknowledgement, country. We acknowledge the traditional owners of the lands on which we meet today and pay our respects to elders past, present, and future, for they hold the memories, the traditions, the cultures, and hopes of Aboriginal Australia. So if you have any questions throughout today's session, please pop them in the chat or the Q&A, and if we have time, we will try to answer these at the end. Any questions that we don't get to answer, I will get the PHU to respond, and I'll send the answers out with the slides and the recording. We would really appreciate if you can complete the evaluation form that will open when you leave the session, just to ensure we continue to provide relevant information for you. As I've mentioned, we will be recording today's session, and we'll be able to provide a copy of the recording along with your certificate of attendance and the slides. These will be sent out to the email address that you registered with within the next couple of weeks. Please be aware that each state has a different immunisation program governed by their state public health unit. So the information provided by the Queensland Health Public Health Unit may not be relevant to some people attending from other states. The information provided at this webinar is specific to Queensland, and we recommend that you check with your local state public health unit for localised information. All information provided in today's session is current as at today. Please refer to the public health unit if you have any queries. Today's presenter from the Metro North Public Health Unit is Michelle Ferguson-Hannah. She's one of the clinical nurses, and I will hand it over to Michelle.
Great, thanks very much, Amy. I might just initially start by sharing my screen, if you just bear with me. Okay, hopefully you can all see that initial page, the update.
Yes, that's great.
And is that in presentation mode, Amy?
Yes, it is.
Okay, great, perfect. I'll just make sure. Oh, it's a little bit slow to go through, right? Okay, yep. So thank you very much, Amy, and to Brisbane North PHN for hosting the webinar. And obviously thank you to everybody joining us online today. This is the first Metro North Public Health Unit immunisation update for 2024. And obviously there's lots of exciting changes happening within the immunisation space. So today we're going to talk about the 2024 free flu program in Queensland. Just checking that that's changed screens for you, Amy. My slide?
Yes, it has.
Yep. Thank you. The COVID-19 recommendations, pharmacy vaccination, meningococcal B and Shingrix recap, some Australian Immunisation Register updates, the school immunisation program, some funded vaccines in Queensland, and then finish up with vaccine storage. Okay, so I'm sure you're all aware of the free flu program for Queensland that was announced late last year. Obviously, it's a very welcomed announcement on the back of the free flu initiative that sort of popped up midway through last year's season. So hopefully we've all had some time to prepare ahead of this program, and hopefully things will go a lot more smoothly. Okay, so just as a recap, obviously all Queensland residents over 6 months of age will be eligible to receive free flu vaccines across Queensland in 2024. I'm not aware of any other states or territories at this point in time that sort of have announced a similar program. So, you know, we're happy to be leading that, definitely. So the Queensland Free Flu program will commence simultaneously with the 2024 NIP rollout. So that usually occurs sort of early-ish April, but the date's still obviously to be advised. So the following cohort will be eligible for NIP flu. So this hasn't changed from previous years. So that will be children 6 months to 5 years, adults 65 years and over, Aboriginal and Torres Strait Islander people 6 months and over, pregnant women at any stage during their pregnancy, and then individuals 6 months and over who have a medical condition that puts them at an increased risk of complications from influenza disease. So they're all your NIP eligible, and anybody that falls out of that cohort will be eligible to receive the free flu throughout the Queensland program. So the ordering of the flu vaccines will continue as per the usual process. So for your NIP eligible cohort, you'll be ordering directly from QUIP, and for your non-NIP eligible, you'll be using your privately purchased stock. So reimbursement for providers will be similar to the 2023 free flu initiative. So there was some information sent out from QUIP, the FAQs that I've got up on the slide that hopefully you've all had a chance to read through. But basically providers will submit their claims to Queensland Health. They have sort of noted in the FAQs that delays may initially occur just due to the volume of requests that they're receiving. And just to ensure that you have the correct documentation at the time of the initial request to minimise any delays in the reimbursement process. So there'll be a fixed rate of $25 for each privately purchased and administered vaccine. So it doesn't, it's not dependent on which private brand vaccine you use. It's $25 for each of them. And there won't be any reimbursement for private stock that's not administered, or if any vaccines are administered prior to the commencement of the program. So more information, including the FAQs, are up on the Queensland Health Immunisation page. And then obviously there's a particular tab just for the free flu vaccination program.
Sorry, Michelle, can I just step in there for a second?
Yeah.
Do we know yet, is there a time frame that practices have to request their reimbursement to the Queensland Health?
Look, nothing's coming to mind about that. Obviously, it will run for the duration of the program.
Yeah. Okay. All right. So I guess I just want practices just to be very aware. In the past, I know that they have put a time frame, and any requests for reimbursement after that time frame, they're not reimbursing you. So once that information does become available, if they have a time frame, I do suggest that you make sure you get all your reimbursement requests through as per the procedure as soon as possible.
Yeah, definitely. Thanks, Amy. So I think the last meeting that we had with QUIP, they're obviously working really hard to get this program up and running, knowing that vaccine service providers are keen for these kind of additional FAQs. So the only thing it says is just reimbursements will be paid on a regular basis. But I guess towards the end of the flu season, I'm not sure if there will be a cutoff. But definitely keep an eye out for any further comms coming through from QUIP. And I guess just to mention it as well, to make sure, so there has been some recent communication sent through about meningococcal B as well that we'll go through. So if you haven't received any of these comms coming through from QUIP, I would suggest you email them. So that's the QUIP admin at health.qrd.gov.au email, just to make sure that you've got the correct email address with them so that you are receiving these updates. Okay. So influenza obviously remains a common cause of hospitalisation and death in Australia. So annual vaccination is recommended for all people 6 months and over, unless contraindicated. So the only contraindication for flu vaccine is anaphylaxis to a previous flu vaccine or component of a flu vaccine. Optimal protection is achieved within the first 3 to 4 months after vaccination. Within Australia, all influenza vaccines are quadrivalent, so they've got the 2 influenza A subtypes and the 2 influenza B lineages. I sort of put here NIP funding ordering to commence from early March. That was based on a December update from QUIP, so I think that's probably more likely to be mid to late March, with hopefully distribution planned for early April. But again, I know that they're trying really hard to secure vaccine and provide further updates to you guys. So please watch this space for additional information about sort of distribution and reimbursement. Okay, so some key points for providers. So you probably are aware that the cell-based vaccine flu cell Vax Quad will be added to the NIP from 2024, and this will be replacing the Afluria Quad. The flu cell Vax Quad is registered for use in 6 months and over, but it'll be on the NIP from 5 to 64 for medically at risk pregnant and Indigenous persons. And just a reminder for adults over 65 years, the adjuvanted influenza vaccine, the Fluad Quad, which is the NIP funded, and the Fluzone High Dose are recommended in preference to the standard flu vaccines. We're still awaiting the 2024 ATAGI seasonal influenza statement to be released. It's usually released around March each year. And obviously that's a key document for providers with lots of information around administration for the flu vaccines for that year. So probably, hopefully that will be released in the next few weeks. So just some precautions with the flu vaccine. So this is all information that's outlined in the AIH, the Immunisation, Australian Immunisation Handbook, the AIH, under the influenza chapter. So people with an egg allergy can safely receive the influenza vaccine. So that's including if they have anaphylaxis to egg. If you have any provider or parental concern at the time, you can opt to keep them, 30 minutes after their vaccination rather than the standard 15 minutes. So people with a latex allergy can receive the flu vaccine. So no vaccines in Australia contain any latex. If you have somebody who's got a history of Guillain-Barré syndrome and that occurred, the first episode occurred within 6 weeks of receiving an influenza vaccine, then subsequent vaccines are generally not recommended, and that would be a discussion with the GP for any further recommendations. So the flu vaccine can be co-administered with most other vaccines. There are a couple of precautions again in the handbook. So if you're giving influenza and Prevnar 13, to a child 6 months to less than 5 years, there is a small risk of febrile convulsions when both the vaccines are received at the same time. So the recommendation is to advise parents of the possible risk and give them an option of administering the vaccines separately. And if they choose to give them separately, you would space them out by a minimal interval of 3 days. If they're happy to receive them on the same day, that's fine as well. The adjuvanted flu vaccines and Shingrix, so they can be co-administered again on the same day if necessary, but preferable to separate by a few days if possible. Again, however, it also identifies in the handbook that we don't want you to delay overdue or opportunistic vaccination, particularly in any high-risk cohorts. So as well as the AIH having information about precautions and co-administration, there's also a really great resource on the National Centre for Immunisation Research and Surveillance, so NCIR's website, that has a handy little table for co-administration of vaccines in adults, and I've just popped a link in there for you. So there are a couple of circumstances where somebody might be recommended to have 2 flu vaccines in the same season. So if you have a child who's 6 months to 9 years and they're receiving the flu vaccine for the first time, they're recommended to have 2 doses 4 weeks apart, and both those doses will be funded. Children who receive 1 or more dose in a previous season only need 1 dose in a current or future season. So if you have a child who presents who's 7 years old and it's their first time getting a flu vaccine, they would obviously be recommended to have the 2 doses 4 weeks apart. If you see them the next year and they're 8 years old, but last year they only ended up receiving 1 dose, even though 2 were recommended, we still just give 1 dose for each season thereafter. So there's no need to catch up a missed dose in that first year. Stem cell and solid organ transplant recipients receiving the flu vaccine in the first year after having a transplant, they're recommended to have 2 doses 4 weeks apart, again, both funded, and also 1 dose annually thereafter. Revaccination later in the same season is not routinely recommended, but not contraindicated. and could be considered on a case-to-case basis, and might be for reasons such as travel, individual risk factors, or pregnancy, or if somebody was vaccinated earlier in the season. And within the AIH, it does talk about all flu vaccines being interchangeable, as long as they're the age-appropriate vaccines that you're using. So ideally, we would recommend for these few people that might need 2 doses to have the same vaccine, but it's obviously good to note that the age-appropriate vaccines are interchangeable. So obviously, please check that you've got the correct vaccine for the correct age group, and that ATAGI statement is a really good resource to have on hand. Please always check air before giving any vaccinations, and as I'm sure you're all aware, all vaccines must be reported to air. Okay, so COVID-19 recommendations. I'm sure you're probably all aware now that the monovalent Omicron XBB vaccines are now preferred for all individuals 5 years and over. So the Pfizer 5 to less than 12 years formulation in the light blue cap, the Pfizer over 12 years in the dark grey cap, and then Moderna is registered for use in people 12 years and older. Currently, there is no monovalent XBB vaccine registered for use in children 6 months to 4 years. And for individuals who have had the recommended 2023 dose of their COVID vaccine, ATAGI, the Australian Technical Advisory Group on Immunisation, does not recommend further doses or revaccination with an XBB5 vaccine at this time. So I've just popped a link into the current recommendations, ATAGI recommendations as well. So in terms of the Australian Immunisation Handbook, the COVID-19 chapter has had some significant updates in October and November. So bringing it in line with a lot of the other disease chapters, kind of your one-stop shop to go for the latest recommendations. The NCRS resources have also been updated in December 2023, and I've just popped a link to both of those. And until the 2024 COVID booster dose advice is released, the 2023 advice is still valid. So you can find these resources. They were updated in December 2023 on the Australian Government Department of Health and Aged Care site. So there's a couple of little tables, obviously the COVID vaccine dose recommendations for individuals without risk factors and with risk factors, and then also a breakdown of all of the vaccines as well. So please keep an eye out for the 2024 COVID booster advice, which I imagine hopefully will be within the next month or 2. Okay, so moving on to pharmacy vaccinations. So we did have a few pharmacists registered for the webinar, so hopefully we have some online with us today. As you probably are all aware, pharmacists have been administering vaccinations, for the best part of 10 years. So the recent changes to the legislation, is really reflecting their expanding scope of practice within the immunisation space. And we know that a lot of pharmacists are open longer hours and weekends, so they really are accessible and convenient places for patients to receive vaccinations. So under the Queensland Medicines and Poisons Act, we have extended practice authorities. So there's also ones for nurses. So there's the extended practice authority for pharmacists. So the EPA version 4 commenced on the 30th of October last year. And the changes to the EPA included a reduction to the age limits that pharmacists can vaccinate. So as you can see, the Appendix 2 that I've popped on the side, the lower age limit has been reduced to 2 years for all of the vaccines. Obviously, not all of the vaccines are registered for use in 2 years and over. So this is a legislation document, not a clinical document. So the pharmacists that are immunising are aware that they need to be looking at the Australian Immunisation Handbook to ensure that the vaccine is recommended for that particular age group to be able to administer it. So there were also some additional locations added where pharmacists can vaccinate, and then some additional antigens as well. So they can now, in addition to the ones already listed, in the red box, they can now immunise for Hep B, HPV, Japanese encephalitis, meningococcal B, typhoid, varicella, and zoster. I've just popped this little resource up here. So the NCRS have a fantastic vaccination from community pharmacy at a glance document. This one is not current, it's under review, but it is a good representation of what's happening across Australia and where Queensland fit in terms of the vaccines that can be administered and the age groups as well. So I would recommend when this one is updated, just to have that one on hand as well. Okay, so the National Immunisation Program Vaccination in Pharmacy Program, bit of a mouthful, the NIPVIP. I'm sure you've all probably heard of this Commonwealth funded program. So it was rolled out on the 1st of January this year with the intent to allow eligible patients to access NIP vaccines in a registered community pharmacy with no out-of-pocket costs. So it's really great to see, in addition to flu, the vaccines that pharmacists can now administer has obviously increased. Currently, the NIP vaccines that pharmacists can order from QUIP include your DTP, Shingrix, Gardasil, flu, meningococcal ACWY. MenB will be available when the state program commences, and then also Prevnar 13 and Pneumovax. So all of the NIP and the state-funded vaccines are ordered through QUIP. In Metro North area, we have 153 participating pharmacies. And of them, we've got about 113 that are already approved to order NIP vaccines. And when I last checked, around 70 or so had actually placed orders or received orders through QUIP. We still have some pharmacies, so about 20 that are in the approval process, and then about another 20 that we're still waiting for documentation to be received. And so obviously until we can approve the pharmacists, they won't be able to order the vaccines from QUIP, and that will include, in March, April, when the flu vaccines are available. So if you're still yet to send that documentation through to us, please do so as soon as possible so that we can get you up and running and able to order. I've just popped a little bit in the bottom, which came from the free flu FAQs as well, just noting that pharmacy VSPs can't use the Queensland Health Reimbursement Pathway to claim for NIP flu, where they would be eligible to claim through the NIP-VIP program. So the Pharmacy Programs Administrator has a portal with all of the rules, a lot of FAQs and information about reimbursement for this program. So to any pharmacists online, if you haven't already had a look, I would definitely recommend making sure that you access the FAQs and the program rules. There are a lot of FAQs in there. I haven't sort of gone through all of them, but definitely a lot of detailed information in there. And there's also information about how to submit your claims as well, with a list of information that you need to be able to provide. And I've just popped the link to the portal for you as well. So the pharmacists have a specific vaccine order form, so you can access that on the Queensland Health Immunisation webpage. So there's a NIP-VIP tile that you can navigate to, or you can also go to the order, store and manage vaccines and just make sure that you're selecting the pharmacy vaccine order form, and then you send that off to QUIP. And I've popped the link in there obviously for you guys to access that if you haven't already. Okay, so we have been working with pharmacies in our area to make sure that they have an approved vaccine management protocol ahead of ordering. So if we have any pharmacists online who have not already completed a feedback survey, we would love for you to provide any feedback around additional support that we can provide in the future. So I'll just leave that up for a second. There is a QR code or a link to register for the survey, and it's only for pharmacists. And we will send another email out probably in a couple of weeks, just inviting you to do that survey again if you haven't already. Okay, so on to meningococcal B and Shingrix recap. Okay, so it was announced late last year that the meningococcal B vaccine would be provided to additional cohorts across Queensland in the first quarter of 2024. So it is the largest state-funded program that's been implemented in Queensland. MEMB, as you're all aware, is currently on the NIP for Indigenous children and individuals with certain medical risk conditions. So in addition to the NIP eligibility, it will be added to the Queensland schedule for all children at 2, 4 and 12 months, with additional doses required at 6 months for medically at risk. And it will be offered as a catch-up to children less than 2 years, and then also to adolescents 15 to 19 years, predominantly via the school immunisation program. So we do know that nearly all of the invasive meningococcal disease cases across Queensland are serogroup B. So this is a very welcomed addition to the Queensland schedule. And obviously it's been on the South Australian schedule for a number of years. So the program will be implemented in 2 phases. Phase 1, which is pretty much commencing now that schools are back. So the Year 10 students will be the first cohort to receive the vaccinations, and they'll be given through the school immunisation program. And QIP have identified that they don't expect any supply issues with that phase 1 rollout for the school program. If you do get calls or inquiries from students that have missed that dose, there will be an opportunity for catch-up via the GP or community pharmacy when the vaccine is made available to additional providers in phase 2. So phase 2 hopefully is mid-March this year, where all other eligible cohorts will be able to receive the vaccine. So again, keeping an eye out for any further distribution updates from QIP. So there was one sent to all vaccine service providers on the 23rd of January, which just outlines that information about phase 1 and phase 2. And in addition to that, the pharmacies would have received further comms on the 30th of January, and that was around an opt-in for the meningococcal B delivery. So QIP are asking for any pharmacist who wants to receive the Bexsero vaccine to provide your pharmacy details, your VSP number, and the number of doses required. So there won't be any differential between the state and NIP stock, so it all will be managed by QIP, and they have requested that you don't make any schedule appointments or recalls until the vaccine is sitting in your fridge. So during phase 2, so QIP will begin distribution of Bexsero to all registered VSPs who have an order history which indicates they have an eligible cohort. They're expecting it will take approximately 2 weeks to provide the vaccine to all of those VSPs across the state, and they're hoping to provide 4 to 6 weeks worth of Bexsero to ensure you have enough stock on hand until your next monthly order. And again, obviously for pharmacies, please refer to the opt-in process and email QIP if you want to receive that vaccine. So once vaccination has commenced during the eligibility period, the person will remain eligible to complete the course regardless of age. So we said that there was a catch-up available until a child turns 2 years of age. So if they have their first dose at 23 months, it's 8 weeks between doses, so they'll be over 2 by the time they are able to have their second dose. That will obviously be funded because they've started it during the eligibility period. Unfortunately, there won't be any reimbursement available for families who have already privately purchased a dose or completed or started a course. However, if they are still to complete the course, the additional doses will be funded as soon as you guys have that vaccine in the fridge. So I guess that's a bit of a win there. So the dosing and intervals are all outlined in the Australian Immunisation Handbook. So as I said, Bexsero will be the vaccine used for all cohorts. So the number of doses really depends on the age that a person starts the course and if they have any medical risk conditions. So for children 6 weeks to 11 months who are healthy, they have 3 doses 2 weeks apart. If they're 12 to 23 months when starting the course, it's 2 doses 8 weeks apart. And obviously for people with medical risk conditions, if they're starting the course between 6 weeks and 5 months, then they end up with 4 doses. Over 2 years of age, healthy, so that this is our adolescents in the school program, so they'll get 2 doses 8 weeks apart. And just a reminder for any child less than 2 receiving Bexsero, there is the recommendation for the prophylactic Panadol. So Panadol should be given 30 minutes prior or as soon as possible after the vaccine. And that should be followed by 2 further doses each 6 hours apart, regardless of if there's a fever. Okay, so moving on to Shingrix. So I'm sure everybody is aware that Shingrix replaced Zostavax on the NIP and has been available since the 1st of November last year. It's great to see the high demand, but obviously that means that there are some restrictions remaining on the your ordering until the vaccine supply has stabilised. So the eligibility on the NIP includes those most at risk of complications for shingles. So that's First Nations adults 50 years and over, and non-Indigenous adults 65 years and over with no upper age limit. It's also for immunocompromised people 18 years and over with certain medical conditions. So that's stem cell transplant, solid organ transplant, hematological malignancies, and advanced or untreated HIV. So for immunocompetent individuals, it's a 2-dose course and the doses are given 2 to 6 months apart. And for immunocompromised, it's a 2-dose course with a dose 1 to 2 months apart. So common side effects, so localized injection site reactions occur in up to 82% of Shingrix recipients. So that's pain, swelling, and redness at the injection site. Some systemic side effects include fever and fatigue, and usually they resolve within a few days. So it is important for vaccination providers to let your patients know and to probably expect definitely some localized and possibly some systemic reactions so that they're aware and you know, they don't have additional concern. And also about the importance of completing the 2-dose schedule because that ensures that they have adequate level and duration of protection. So co-administration, so Shingrix can be co-administered with other vaccines if required. So the AIH state to consider giving separately from other vaccines as there's a potential for an increased mild to moderate adverse event when given at the same time as other vaccines. But again, we don't want you to delay any overdue or opportunistic vaccinations, particularly in the high-risk cohorts. And the NCRS have a lot of information as well on the Shingrix vaccine, and they've got some really great FAQs as well. So I would definitely encourage you to have a look at those. So until the vaccine supply stabilises, we're still recommending to prioritise first doses and high-risk patients. So if a person has previously received a funded zoster through the NIP, then they're not eligible for a funded Shingrix until 5 years after their zoster dose. If a person privately purchased a Zostavax and they're meeting the current eligibility criteria, they can have a funded Shingrix 12 months after their Zostavax dose. And it's important to let them know that they'll still require 2 doses of the Shingrix. Eligible people who received 1 dose of private Shingrix can receive the second dose funded. And for anybody who's had shingles, it's recommended to wait 12 months before receiving the vaccine if they're immunocompetent. Otherwise, it's 3 months if they're immunocompromised. And I guess it is also important to note that both meningococcal B and Shingrix are available via private script for those who are not eligible as part of the NIP or state-funded programs. So meningococcal B can be given to anybody over 6 weeks of age who wants to reduce their risk of becoming unwell with invasive meningococcal disease, and Shingrix can be given to immunocompetent individuals from 50 years of age, privately purchased. Okay, so just to quickly let you know as well, the adverse event following immunisation form has been updated. And it now includes the recording of vaccine administration errors as well. So it's great to have the one form for both of those reporting. And there's also no longer a separate reporting form for COVID vaccines. So everything on the one form. You can just Google APHI Queensland and the form usually will pop up, but otherwise you can navigate to it through the Queensland Health website as well. So this is what the form looks like from November, updated in November. So to record a vaccine administration error that didn't result in an APHI, you can just, where I've got the red highlighted, you can just tick the VAE. But obviously, if you had a vaccine administration error that resulted in an APHI, please tick both and then just complete the form as you normally would. It's obviously important that APHIs are reported promptly, and then the information to where to email it and fax is on the form as well. It gets sent through to CEDAS NOC support, and then we receive it here at Public Health to follow up. Okay, so we'll move on to the Australian Immunisation Register, or AIR updates. I certainly don't pretend to be an expert in AIR. I call the register quite often to help me troubleshoot, but I did attend a webinar in December and thought that these updates would be useful to pass on to you guys. So as of December 2023, the men-be due and overdue rules were added for First Nations children up to 2 years. So noting that AIR is a national register, so I don't expect any changes will be made to AIR in relation to the men-be program being rolled out in Queensland. So it's important to know that men-be vaccination won't impact on family assistance payments. But it will now show up on the immunisation history statement as due or overdue for First Nations children up to 2 years. Also, for your awareness, HPV reminder letters were sent out in November 2023, and that was really as a reminder to get people caught up with additional doses prior to turning 26 when they're no longer eligible for free vaccine. And the medical exemption, encounter and history forms have all been updated to include Vexero and Vexalis as well. And definitely digital lodgement is encouraged so there's not delays in getting that record updated. So there is also a new report available, the 43A report, and that includes all vaccinations recorded under your particular provider number. So I have just popped a little snippet in there from the Services Australia site that says that this report will probably be particularly useful for pharmacies participating in the NIP VIP when you're wanting to lodge your claim. So there's a link that will show you how to download and access that particular report. So there's also some new data fields which have been available in AIR that you're probably aware of and have seen. So the vaccine type, which is obviously relating to the funding, has been available since December. And this field will be mandatory from the 1st of March this year. So probably a good idea, if you're not already doing it, to make sure that you're selecting your vaccine type. So there's NIP Commonwealth, antenatal, private or state program to choose from. And the information from AIR is that the antenatal option should be selected for anybody who is pregnant at the time of the vaccine, regardless of if that vaccine was private, NIP, or state or territory program. And all COVID vaccines should be reported as NIP Commonwealth. So there's also a route of administration field that's been added, and that will be mandatory for JEV vaccines only from the 1st of March. And batch numbers, so up until now they've been mandatory only for COVID, but they will be mandatory for all vaccinations from the 1st of March as well. So probably a good idea, if you're not already, to start getting used to adding those in routinely. Okay, so some common reporting errors. So quite often the register will see incorrect vaccines reported for age groups. So please always check that you've got the correct age appropriate vaccine. And then also vaccines due to naming conventions. So Fluad Quad, Flu Quadri, Boostrix, Boostrix IPV, etc. So please just make sure that you're entering the correct vaccine in your practice software, or if you're going straight into AIR. If you do need to amend an incorrect record, you can use the AIR site, logging in through Proda or your software to update that encounter. So you can only update or edit a record if it was you that submitted it to AIR. So to do that through Proda, you identify the individual, select update encounter on the left-hand column, and then over on the right, if a pencil icon comes up under the actions column, that means that you are able to edit it. If you don't see a pencil there, it means you're not able to edit it and you would need to contact AIR. And us at Public Health, we can't edit. This is one that we've obviously entered. That's why the pencil's there, but we can't edit records that are submitted by another provider. So the Services Australia website has some great AIR resources, as well as some e-learning tools, and the NCRS have a whole gamut of AIR tips that are added quite frequently. So I would recommend you having a look at those if you're having any trouble as well. Okay, on to, how are we going for time? Okay, on to the school immunisation program. So this is really just to provide an update of what the changes that have happened over the last few years. So within, as it stands now, within 2024, Year 7 students receive 1 dose of HPV vaccine and 1 dose of a DTP vaccine. And the Year 10 students receive 1 dose of Nimenrix, meningococcal ACWY, and 2 doses of MenB, which will be Bexzero. There's 102 schools in Metro North, and Auscare is a service provider for all our Metro North schools. And obviously all vaccines that are given via the school immunisation program are recorded on AIR. So catch-up for SIP vaccinations. So some catch-ups may be offered at school. Otherwise, individuals who have missed it at school can receive the vaccine for free at their GP or community pharmacy before turning 20, or for HPV, it's before turning 26. And just a reminder for the HPV dosing, so immunocompromised children require 3 doses of HPV vaccine, and adults who are starting the course at greater than 26 years also require 3 doses. And the scheduling for that is at 0, 2, and 6 months. Okay, funded vaccines in Queensland. So we receive calls from time to time, specifically around, is this vaccine funded for this age group or this risk group? And I guess it's important to note that for most vaccines, the Australian Immunisation Handbook will outline the recommendations and not necessarily what is funded. And as I've said, the AIH is a national resource, so it's not specific to Queensland. So please, happy for you to give us a call if you've got any queries. So pretty much all of the information regarding funding can be found on the Queensland immunisation schedule. So We have the adolescent and adult schedule and the medical at risk. So they were both updated in November 2023. And then in addition, we obviously have the childhood schedule and then the catch up for 10 to 19. So all of the schedules are in the process of being updated, and QIP have advised that they won't be released until after the second phase of the MENB rollout, so around mid-March. So please keep an eye out for the new schedules and make sure that you access them online when they're available. Previously, QIP have stopped sending out schedules. We're not receiving printed copies, so you will need to go online and print them off yourselves. So we usually print them off in A3 and laminate them here at Public Health. So obviously that's the childhood schedule and the catch-up as well. And just a note for COVID vaccinations, obviously they're free for everyone in Australia, even if the person doesn't have a Medicare card. So all NIP childhood and catch-up vaccines on those schedules are funded for individuals up to 20 years, with the exception of HPV, which is funded up until 26 years of age. If a course is started prior to turning 20 or 26 for HPV, so during the eligibility period, then all the doses to complete that course will be funded. So if you have an individual that needs catch up for Hep B and they need additional, they need prior to turning 20, then all of the doses to complete that course will be funded. We do get a lot of calls from time to time about children who are travelling regarding the MMR vaccine. So if a child over the age of 6 months is travelling to a measles endemic country and it's been deemed that MMR would be ideal after an individual risk assessment, then that child can have that MMR free before they travel. But obviously, if a child gets the MMR vaccine at less than 11 months of age, it won't be recognised as a valid dose, and they'll still need to receive the funded vaccines as per the NIP. So they'll still get an MMR at 12 months or 4 weeks after their last dose, and they'll still get an MMRV at 18 months of age. So essentially, that child would receive three free MMR containing vaccines, and that's definitely approved and appropriate, and we want you to be vaccinating those children before they're travelling wherever possible. So Hep A catch-up is recommended for Indigenous children up to 10 years of age, and they're funded doses, and that information is in the AIH under the Hep A chapter. So meningococcal ACWI, obviously, as part of the childhood schedule, it's funded up until 10. And then as part of the 10 to 19 catch-up, it's on there for ACWI for 15 to 19-year-olds. And on the catch-up, it says for children 10 to 14 that they need a meningococcal C vaccine, which obviously is the Nice-Vax C. We're happy within Public Health, Metro North Public Health, for the child in that instance. So for example, if they're born overseas and they didn't have a MenC vaccine, we're happy for them to have the Nimenrix instead of perhaps having to order Nice-Vax C and recall the patient. So that's certainly advice that's been provided for additional PHUs around the state. So certainly happy for you guys to call us if you've got particular queries, but please give the Nimenrix for the 10 to 14 catch-up. And so for varicella, if a child's starting the course at less than 14 years of age, we know that 2 doses are recommended, but there's only 1 dose that's funded as per the NIP, and that's the MMRV that's given at 18 months. So obviously a parent could opt to purchase an additional varicella privately. But for children who are starting the course greater than 14 years of age, both the doses will be funded. And so 2 doses are required to ensure adequate protection for adolescents and adults. So that information is also in the AIH. So in addition to the schedules, the Queensland Health Immunisation webpage also has additional information about Hep B vaccine. So It's on the NIP and also includes funded doses for low birth weight or premature infants at 12 months of age. But it's also funded for household or sexual contacts of people with Hep B, migrants who have a Medicare card from Hep B endemic countries, Aboriginal and Torres Strait Islanders, people with chronic liver or Hep C, and people who inject drugs. There's also additional funded vaccines for pregnant women, so that's the pertussis, flu, and COVID. I've also just popped in there the National Immunisation Catch-Up Calculator. So that's available through the Australian Immunisation Handbook. And just for your awareness, when you put in the details for a catch-up, it will provide you with all the doses that are recommended and funded. So you can see, for example, this is a 7-year-old child, and it's got varicella, dose 2 of 2. So they've already obviously received their first funded dose, and they have recommended an additional varicella. But you can see by the dollar sign that that's indicating that it might not be funded under the NIP. So just to be aware of that if you are using the catch-up calculator. So we've also developed catch-up worksheets here at Public Health. So we have a separate worksheet for children less than 10 years and over 10 years of age. And we've also provided in the comments information about funding. So we are happy to provide these. I believe they might be on the PHN website. I'm not sure if the most updated one to include the Bexero is on there, but we're certainly happy if you want to call or email us, and we can send these out to you guys, no problems at all. Okay, so lucky last, we're on to vaccine storage and management. So hopefully I'm just checking the time. Yep, we should be fine. So safe vaccine storage. So what is the cold chain? Obviously the cold chain is the system of transporting and storing vaccines within the safe temperature range of +2 and +8. Strive for 5, as in the title of the National Storage Guidelines, means that the average temperature of the vaccine fridge, you should be aiming for around +5 degrees. And that allows a 3-degree variation on either side. So the cold chain begins from the time the vaccine is manufactured and ends when the vaccine is administered into the patient's arm. So vaccines are delicate biological substances that become less effective or destroyed if they are frozen, allowed to get too warm, or exposed to direct or UV light. Different vaccines have varying degrees of heat stability and sensitivity to freezing, and repeated exposures to temperatures outside of the +2 to +8 range diminishes the vaccine potency. So the effect is cumulative and it cannot be reversed. So effective, efficient vaccine storage and management will ensure problems are identified and managed before an ineffective vaccine is used. And that's really what we're aiming for. We know that cold chain breaches will happen due to storms, your power failures, human error, but we really just want to make sure that you're on top of your monitoring, your cold chain monitoring, so that those breaches are picked up prior to anybody being vaccinated with an ineffective vaccine. So obviously incorrect storage and handling can lead to revaccination, which we're really trying to avoid. There's obviously a financial loss associated with discarding of vaccines and potential loss of confidence in a vaccine program. So if we don't protect our vaccines, they won't protect our community. So the National Vaccine Storage Guidelines, Strive for 5, I'm sure you're all very familiar with these. They're currently in their 3rd edition, and they provide information and advice around safe vaccine storage, and as well as rationales for the recommendations that they make. And apparently maybe they're being updated, hopefully in the near future. Equipment and monitoring. So all vaccine service providers must have min-max thermometer. So these are battery operated. You need to check the accuracy with a slush test and change their batteries at least annually. You need one for each fridge that you have, each vaccine fridge, and one for each esky, so that you can continue to monitor temperatures during a power failure. Data loggers, so all VSPs must also have a data logger, either inbuilt or external, and they provide continuous temperature monitoring. Data loggers need to be set at a minimum of 5-minute intervals. And the data logger needs to be downloaded and checked for any excursions outside of the +2 to +8 at least once a week, or more frequently depending on your brand of fridge. So we have noticed when we're doing our VMP audits that we're receiving the VMP and the fridge temperature monitoring, and within the data logger downloads, there are a lot of temperatures above or outside of the +2 and +8. So please make sure that you're checking for any excursions and following up appropriately. We don't want to wait until you're sending it through to us for a routine update to identify that there's been a cold chain breach. And if you do have a cold chain breach, we will ask for the numerical data, not the graph. So just be aware that you will, or ensure that you know how to access that data. So all providers must ensure that the min-max temperatures are manually recorded twice a day as a timely alert to any cold chain breach. And we would recommend using the Strive for 5 min-max temp chart, which you can download from the Australian Government Department of Health website. And we've just included a sample completed copy of that. So please ensure that you're recording the min, max and current temperature, as well as plotting them on the graph. And if you do have any temperatures outside of the +2 and +8, if you can make sure that you're noting the reason for that on the back as well, and the action that was taken. So vaccines from a community pharmacy. So doctors should advise clients about the importance of the cold chain when the prescription is provided to the patient, and you should always ask them to inform reception staff when they arrive if they have a vaccine that needs to be put into the fridge. Obviously, as an immunisation service provider, if you have any concern that a vaccine that's been provided by a client hasn't been stored in the recommended +2 to +8, please don't administer the vaccine. And obviously this may result in additional costs to the client. I will have to skip through a bit quicker, sorry. So cold chain breach, obviously it's any temperature outside of the +2 to +8, and it doesn't include any temperature deviations or excursions up to +15 degrees, +12 degrees, sorry, for 15 minutes or less. But any deviation below +2 must be reported, and obviously they're all reported to QIP. So power failure, fridge malfunction, and then potentially some human error, obviously, are how the majority of cold chain breaches occur. So to report a cold chain breach, please complete the cold chain breach reporting form and send it off to QIP, and then Public Health will follow up with you. I've just provided a slide on a link, sorry, to how to pack a vaccine cooler as well. In terms of transferring and monitoring vaccines in an esky, please make sure you have 1 thermometer per esky. Make sure you keep an accurate record of the temperature in each esky, and make sure you record which vaccines are in which esky as well. So key recommendations for safe vaccine storage. So please ensure that you're completing a vaccine storage self-audit every 12 months. And that can be found in Appendix 2 of the national guidelines. Please make sure that you have a vaccine management protocol, and these are required to be updated annually, and we're happy to send you through the template. And then you probably, hopefully, have all completed the online training. So the QIP, in collaboration with the Cunningham Centre, have developed these immunisation training courses that are free of charge. And I've just popped a link in if you need to access that as well. Please remember to complete a vaccine discard or transfer form if you have any expired vaccines or you're transferring them to another practice. And there is a separate form for flu vaccine as well. The last thing really that I had was just a couple of MMPH FAQs that we get here. Amy, did you want me just to stop here, noting that I'm about a minute over time?
Yeah, that's fine. As I mentioned earlier, these slides will be sent out to everyone, so they can have a read through that. Do you have an email address, Michelle, that people, if there's been no questions throughout today's presentation, but if they have any questions, what's the best email, or is it just
Yeah,
the phone
so
number?
yeah, they can call. Sorry, I should have put my email on. So it's mmphu-immunisation at health.qld.gov.au. But obviously happy for anybody to give us a call. And I've just popped on there, the next immunisation update we have will be Tuesday the 16th of April as well. So sorry, I did run over. I must have slowed down somewhere at the start.
That's all
But
right.
yeah, obviously the slide that I skipped over, the FAQs, we get a lot of calls about that. So that's fine if people still want to call us about that. And then if you've got any questions after, we'll get back to you.
Okay, sorry. I've just noticed Evelyn had her hand up. Evelyn, what did you have a question? Hello, Evelyn. Okay, I'm not sure what's happened there. Evelyn, are you able to put in your question in the Q&A or the chat? Okay.
Oh, I should stop sharing, sorry.
That's all right. Yeah, so Evelyn, you're welcome to either email myself or Michelle on that email address she gave just before, or anyone is obviously, or you can give Michelle a call. Otherwise, I'll leave it there. If everybody would like, if you could please complete the survey that will pop up when you leave. And we, as I've mentioned, we will send through the recording, your certificate of attendance and slides to you all within the next couple of weeks. So thanks very much, Michelle, and thanks everyone for attending.
No worries. Thanks, Amy. See ya.
Thank you. Bye.
Bye.